Hello and welcome to our COVID chat. With us today is Chief Medical Officer Dr. Seth Kaufman. Take it away, Dr. Kaufman.
Hey, thanks, Robin. Good morning, everybody. A reminder that we are periodically doing these COVID updates. We are doing this, and what I'll do is I'll start with some hot topics, and then we're going to go right into your questions. I'm just going to start, in case we run very late, just say that tomorrow is Veterans Day. And I'm so thankful for our military who keep us safe and allow us to have the freedoms that we have now. So thankful. And with that, we'll get into some of the hot topics. The first hot topic is just what we're seeing with our COVID rates. In the United States, we surpassed 750,000 deaths. That does beat the Spanish flu for the U.S. numbers. Of course, there was less population back then. It beats many deaths in some of our wars, at least some of the. So it's a very high number, and of course we're all very concerned about it. But it's definitely sobering. Definitely sobering. We are starting in California to see some increase in rates. Now we've gone through this before, so we generally have followed a spike in Europe. Europe is seeing a very large spike of cases, despite in many pockets having a higher vaccination rate than the U.S. So all of it is concerning that we may see a spike. Likely we'll see a spike in the coming weeks. So Solano remains fairly flat, and I'll go to those numbers in a second, but we are seeing pockets, and there's a number of them, but Riverside County, some of the Central Valley, Los Angeles, and others are starting to see a significant rise in cases. So we need to be careful. We need to be careful as we enter this holiday season. Some numbers, going to look down at my computer here. Our 7-day average rate in Solano County as of 11/4 was 38. That's the last numbers I have. That's not too bad. We have seen lower than that, but 38 is not low. It's not high. It's been kind of rumbling around there. Our hospitalizations, which is my number one metric I look at, if COVID continues, this is where the vaccination is so important. Even for breakthrough infections from the vaccination, it's very rare for those patients to get very, very sick. So, because that's what this is about. Can we avoid having a lot of hospitalizations, a lot of death, a lot of severe illness? Our hospitalization rate in Solano has been in the low 30s now for a while. During the last nadir, so the low point of between the spikes last time, we were even in the 20s in the county. We're in the 30s right now. It's been that way for a while. It doesn't. I don't have a lot of opinions around it today because it could stay like that because we've been making a lot of efforts to get boosters to our higher risk individuals. Our kids are starting to get vaccinated. Could we reach a level of vaccine plus those that have natural immunity? Could it be at a level that avoids a major spike in hospitalizations? I don't know that answer. There's opinions all around. There's not a lot of opinions that say there won't be a spike of cases. The question is, will we also see hospitals at capacity, things like that? So it's hard to know. But right now, today, overall levels are flat for Solano, but they're rising in other areas that have higher vaccination rates, areas that have lower vaccination rates. There's not necessarily any sort of pattern of increase in cases. So it might just be that overall we're starting to see a rise in cases. It's just starting in certain pockets. And I would love if I was wrong. Be really happy if I was wrong. Let's see. In terms of vaccination rates, fully vaccinated in California is about 62% of the population. In Solano, it's 59.7%. You'll see numbers all over the place, and that's because the denominator can change. So we sometimes report out how many people got a first shot, right? And if it's Johnson & Johnson, it's the only shot. But for everybody else, it's 2 shots. Sometimes we report out the percentage of eligible residents. So those now 5 and up, but as of 2 weeks ago would have been 12 and up. So if you're seeing different numbers like Dr. Kaufman, 59.7, what does that mean? I've seen 70%, I've seen 80%, I've seen 65%. That's because look at how they're defining the denominator, the population that they're comparing it to. I think the best thing to look at is the total population. Because what do we care about? We care about herd immunity. Can we reach a level where people are vaccinated and it's not transmitting around? And so you should look at the total population. Even if that means there's a whole group that can't get vaccinated, like today is, the under 5s, right? So anyways, it's 59.7. It is a few points below the California average. the California percentage, not average, of those that are vaccinated. It's a little higher than the U.S., and we are the lowest in the direct Bay Area. We are the lowest in the direct Bay Area. Other hot topics. As you know, the 5 to 11-year-olds started getting vaccinated. I think we're about 1 million kids, 5 to 11, got vaccinated in the U.S. since this all started last week. My kid got vaccinated this week. She did just fine. So let's go on the hot topic of pediatric vaccinations, 5 to 11-year-olds. A few important things to know about it, just really boiling down what's important for you to know about the pediatric vaccinations. 1, it's Pfizer. 2, it's a third of the adult dose. When they first did the studies, the first phase 1 studies where they're just looking at safety and the groups are smaller, they tested 3 different doses, including the adult dose. And the kids had lots of reactions. Not death and serious, very, very serious stuff, but just, a lot of like reactions to it. And they then, and as they looked at the impact, like how was your antibody response to it, they settled on this third dose. And the good news about that is that we know it produces a robust response, but the side effect profile is much better. My kid had a little sore arm, that was it. And the data shows that a lot of kids will have a sore arm, maybe a headache, a little fatigue. The side effect profile, like the percentage of all those symptoms, looks much better than the adults. And a reminder, those shots really hit me hard. I get fevers and everything. I have a pretty brisk response. I'm never nervous about it. It shows it's working, but my kid barely had a response, and it's safe, and you should get your kid vaccinated if you have a kid in that age group or in other age groups above 5 and above. The unbelievable rise in cases in Europe, in a lot of those pockets are because the kids aren't vaccinated. And kids, they're seeing in some areas of Europe that it's being led. The pandemic spike is being led by those that are around 10 to 15 years old, and they're eligibly vaccinated. But that is the lowest group in Solano. It's a little over 50% of 12 to 17-year-olds. I may have my age wrong there by a year or so. Are vaccinated. That's the lowest group compared to our older groups, which are north of 80. So if you're saying like, well, who cares? They rarely get ill. It matters how you want to look at it. The children's hospitals were and are filling up with kids that are sick because so many are getting it. So maybe by percentage, there's a low chance they get very ill. But I don't want my kid to be sick. You don't want your kid to be sick. Also know that there's other things besides getting hospitalized that we care about. Long hauler syndrome. You want a foggy kid who's kind of having a hard time concentrating, doesn't feel good, breathing problems for a while. I don't, and you don't. And for those of you that have gone through this, you know how horrible it is. So a lot of reasons. The other reason besides just their health, and you've heard this 100 times, is the kids, and that's what we're seeing in Europe, the kids that get it, they're kids and they're being as careful as they can be, but that's how it spreads, right? It spreads from person to person. So it's our kids going to visit grandma, which they need to go visit grandma. My kids need to visit grandma, and that grandmother may be unvaccinated, getting very sick, maybe vaccinated but still getting with some waning immunity, getting sick. Okay, so that's enough about pediatric. Lots of ways to do it. Go to myturn.ca.gov. I was just in there looking at all the different options. There's a 5 to 11 option in there now. It's been there since this went live, and we'll go from there. So lastly, for the hot topic, I want to look at my time here. Lots of news media encouraging data on antiviral treatment for COVID. I think it's really exciting, and I'm just kind of holding my breath waiting for the FDA and maybe California has its own kind of independent group to review it. Pfizer has a product, a pill. Merck has a pill. Merck's data shows that taking their pills early, for both pills, you got to start early in the disease course within a few days or somewhere around there, cuts hospitalization and death by half for the Merck, by 89-90% by Pfizer. Those are great numbers. Those are game-changing numbers if they're true. Let's have an independent analysis. There's already been some independent analysis. Looks pretty promising. Pfizer's done a very good job up to now. And I'm sure Merck is doing a good job too. Let's let those independent advisors, whose only goal is safety and health, to review and decide that it really is worth that EUA, okay, versus the pharmaceutical company sponsored studies that are out so far. I don't know if the complete data has been out. I haven't seen it. I think it's mostly been kind of press releases and things like that. So I think there's still more information before you hear me talking about it, telling you where to get it. We know there might be some shortages early on, but that would be really helpful to keep people out of the hospital and healthy for those who have COVID. Getting COVID's not great, whether you get super sick or not. So you're seeing some of the discussions around like, well, I wonder if it'll decrease people's interest in getting vaccinated. It's no different than, in my opinion, any other disease that we get vaccinated for. Would you rather not get chickenpox or get chickenpox? That's the reason to get vaccinated. But if you get a disease and there's a treatment for it, great. If you get flu stinks to have. Tamiflu has some mild impact and helps a little bit. So that's great. But if having Tamiflu out in the world for flu doesn't mean you shouldn't get vaccinated because, I have a pill that can help it. There's all these other impacts of COVID that don't feel great. So that's all. So I think we can go into that more in a different session, but I think there's some media press around and there's some projections that, some estimations that an antiviral pill will decrease vaccinations. That's almost a sociological study, and I'm sure it's true to some degree. To me, it just seems like very different discussions. Do I want to have COVID at all? So now I need a pill to make it so I don't get very sick, or do I want to prevent getting it? Okay, so I think that is all I have, Robin, and I'm ready for questions.
All right. Well, Sharon is asking us, she says, I got COVID in June of 2020, and I still don't have all of my smell back. Should I be concerned?
Good question, Sharon. And what you're experiencing is very common, unfortunately. It's definitely, there are treatments for it. There are treatments. There's not pills or medicines to my knowledge, but there are kind of almost like physical therapy for smell and taste. Go see your doctor. Look it up. Europe set up a bunch, and I'm sure there's some options in the U.S. at some of our bigger health centers where there are options for those who have some of these longer-term symptoms from COVID, and yours would definitely be considered long-term, to try to get some of that back. I don't know the data on how successful those treatments are, but you're not alone, and there's nothing, this just happens. I'm not aware of any studies where, if I did something different, it would have changed. You were just unlucky that you have, at this stage, a permanent change here in taste and smell. We do see that. That is part of the long hauler list of symptoms, and I'm sorry, but there may be options for you. We're going to stay optimistic. See your primary care doctor. Look at some of the bigger health systems and see if there's options for long hauler treatment. And again, it falls into, I think, like kind of physical therapy, like trying to like exposure therapy, getting smelling things, tasting things, trying to kind of retrain your brain to taste and smell. I think there are options even this far out.
Okay. Kathy's asking about new treatments. You talked about the potential for these pills. Are there anything new? We've been doing things like remdesivir and Regeneron.
Good question. Good question, Kathy, and thanks, Robin. Treatment options for COVID. Most of the data that's come out in the last handful of months really reinforce our current treatments around steroids and some of the antiviral treatments that really only work for those that are severely ill. And then these new antiviral orals. Monoclonal antibodies continue to be very valuable, and there's studies showing it does have value. The use of them expanded from, hey, I got COVID, but I'm not very sick, and I'm high risk, and that was one group that we were giving monoclonal antibodies to, like Regeneron, what President Trump got at one point. And now it's expanded to those who are high risk, who potentially got exposed, for instance. So I say monoclonal antibodies continue to be a very valuable treatment. Steroids, remdesivir, other medicines. I think what's really had the headlines are these antiviral pills, because everybody's been searching for a pill, trying to find an oral medication that would be effective. I would say the other efforts, by the way, are finding easier, trying to develop strategy to have better access to vaccines. So oral vaccines, nasal vaccines, COVID vaccines don't require refrigeration so that we can get it out to the rest of the world more easily. A reminder that the vaccine, that COVID mutating and creating new variants and passing from one person to the other has no borders. We can continue to improve and upon our vaccination rates and keep ourselves safe with preventative measures here in the U.S. But as long as there's pockets in the world that can harbor the virus, it's going to continue to mutate, create variants. We do need a global strategy. There is one, but it needs funding, resources, things like that. So I think one really, really great effort is if we could just not have to have it super refrigerated and maybe it doesn't have to be a shot, then it's easier to get these medicines out to more rural areas, countries without a refrigeration infrastructure. And I know that's happening too. And that's not exactly what you asked, but it gave me an opportunity.
All right, great. Stephanie is asking if there's any research coming out yet on babies born while their mother was vaccinated in the 3rd trimester. Are they getting COVID side effects, etc.?
Yeah, more and more data is overall just showing that that the vaccine is safe in pregnancy. I have not heard of any of the babies getting side effects from the vaccine. I don't know if there's been specific studies on that, but that's not something that we have experienced, I guess is what I would say. I would just say the data shows overwhelmingly, which is why you see the CDC continue to up its pressure, and it's all about health and safety, that pregnant women are at higher risk for getting sick. So it is recommended any trimester, and if anything, it protects the baby. And versus, I have not heard of any adverse effects with the mother getting vaccinated on the newborn. The newborns can get COVID if the mom has COVID, and if the mom has COVID, but that's different. But not from the vaccination.
Okay. Is Delta still the major variant, or are there other variants we're watching?
Yeah, so the question there is about the different variants. Delta remains 99+% of all the variants we're seeing. There's a few others we're following. You might hear in Europe them talking about a Delta sublineage, AY4. Those are still Delta. And the good news about that is it may be slightly more transmissible, but we know that otherwise it looks functionally like Delta, which means the vaccine works against it and things like that. So when you're when you read the newspaper around the different sublineages, just know that all that is still Delta. Delta seems to be outcompeting everything, and that's actually good because we know the vaccine's effective against it. We'd rather not have a whole new variant that requires data on whether the vaccine is effective, tests on whether it's more transmissible or not. Delta is unbelievably transmissible, passes very easily, but we know the vaccine's effective against it. So as I see that 99+% every week and not seeing another variant take over, it gives me confidence that we can eventually stop seeing spikes of cases. We'll continue to have rumblings of cases. It'll be endemic, but I would love to stop seeing big spikes. It is very hard to manage from a healthcare perspective, and it's very hard, and it doesn't keep our community safe by having big spikes of cases like this. It's very hard to have all the resources to help everyone at the same time.
Is there a concern as we enter the holidays about another spike?
Is there concern around the holidays? Yeah, maybe to summarize, Robin, is there concern? Yes, there's a concern that there'll be another spike. Because there are some projections that we've reached a certain threshold of vaccination rates in some pockets. I think there's still maybe some mixed opinions of how big that spike will be. And there's some experts say we're going to see a big spike. Some say it's hard to know. So I think in summary, yes, we will likely see a significant increase in cases. I don't know how that's going to play out on hospitalizations, but yes, I think we'll see a significant increase in cases. And my hope is as we continue to grow our vaccination rates, and unfortunately we'll probably continue to grow our natural immunity rates, that maybe spring we'll start feeling maybe a new normal feeling where things like we don't feel like we're going to see a spike every few months. Maybe I'm kind of, that's kind of a little of a crystal ball thing.
You talked about in Europe, but I'm curious, are the local cases, the majority of the hospitalizations, still among the unvaccinated?
Let's see. Our listeners asking if we are seeing what our cases look like that are in the hospital. I think, and it hasn't changed for quite a while. The majority are unvaccinated who get admitted to the hospital, and the vast majority of those who go to the intensive care units, so our sickest patients, are unvaccinated, and it's very rare to have a death of someone fully vaccinated. The age range has shifted towards younger because of our vaccination rates, right? So we have more of our older, higher risk patients fully vaccinated, and less of our younger adults. So now they get sick less. So there's still a lot, so the age range is all over the place. But at the beginning of the pandemic, it was really predominantly an older generation or those with immunocompromising diseases like diabetes or cancer. But now we kind of see more of a mix because of that, of the vaccinations.
Okay. So why is it important for children to get this, and can they still spread the virus even if they're vaccinated? Why
is it important for our kids to get vaccinated, and can they spread the virus? Those are two important questions, and the first one's easy, and I'll summarize what I said at the beginning of the talk. The second one is a little tougher, but not much tougher. So the first question is it important for our kids to get vaccinated? And I think, by the way, the context of this question is something I ask myself every day: is my kid safe at school? So why don't we'll add that into the last as a third question. And I have 2 school-age children. The first question is, yes, they should get vaccinated. As I said at the beginning of the talk, there are kids who get severely ill. There are kids who have kind of longer-term symptoms that are harder to detect because they're kids sometimes, and then they can pass it on to others if they're not vaccinated. Question number 2, there's no difference between kids and adults on this. If you're vaccinated, can you pass it on? The answer is yes. And there was a landmark study, I guess, observational study from Provincetown that showed that vaccinated people for some period of time can transmit it at the same rate as those that are unvaccinated. I think that conclusion, I think, what isn't the whole picture. And more data has come out since that story and observational kind of observation that those that are vaccinated likely pass it on a lot less than those that are unvaccinated. Maybe there's a period of time right at the beginning, which is where that Provincetown information came from. Right at the beginning, their viral load in their mouth is high. Maybe for a short time, they're equally able to transmit it, maybe. But it's a shorter amount of time, and then it drops off very quickly because they're vaccinated and their antibodies are responding. Their body is responding and kind of attacking it, and at that time they can't pass it on. So the summary is, if your kid's vaccinated, they're highly less likely to pass it on to others. So masking works. So that's objective. There are studies showing masking stops transmission and vaccination stops transmission. Nothing's 100%. Vaccination doesn't stop infections. Masking is not 100%. We're not seeing tons of outbreaks in schools at all. And remember, we have a whole large group of kids not vaccinated because they either weren't eligible or chose not to be for now. It's masking, right? It's masking. It's common sense, like hand hygiene. It's everyone being careful that allows our kids to be in school and safe and learning. Okay. Oh, third question. So, is it safe to go to school? Yes. If your kid's vaccinated, especially, and I think the schools are doing the best they can to keep everybody safe. And so I'm sending my kids to school. My kids are not in remote programs, and I respect, I think our parents who have concerns and are choosing kind of remote options for the kids, that sounds fine. I think those who have chosen to go the kids to school, for now, as long as we control the pandemic as best we can and get people vaccinated, that's the right option right now.
Now, I know when my kids were little, they weren't real thrilled about needles. I'm a grown-up and I'm not thrilled about needles. So, any advice to parents on helping their kids understand and maybe not fight so much getting the shot?
And, that question is about needle phobia and just how to get our kids to get vaccinated. I'm an ER doc. I see a lot of children and do more things than shots even. So I understand the question. I also have my own kids who have their own fears and phobias. I'll say this, a couple like pearls for you to talk to your kids about. Number one, what I'm seeing in my community is my kid was waiting to get vaccinated because her friends were, her sister was, the older kids are. So honestly, unlike other vaccinations where it's on the news every day, my kid was like, when can I do it? Even though she's completely fearful of getting vaccinated. So I think it was more like she felt like, I know that's a thing I want to do, and there was a certain peer pressure or peer awareness. So I think that helps a lot. Like, hey, everybody's doing it. So that's comment number one. Comment number two is finding the most comfortable environment for yourself. Our pediatricians are doing it here. So we realize that many of our kids wouldn't easily be happy going to an unfamiliar environment for this shot when they're used to getting their immunizations at at their pediatrician's office. So at NorthBay, our pediatrician office, our Center for Primary Care, are doing it as part. We've added slots, we've carved out slots, and we're doing it as part of our regular immunization slots for our kids. So take them, if you have a child who has a phobia, I would think the going to where you receive care would be a good option. Don't go to a new environment. The MassVax Clinic, Walgreens, CVS, they all have it, by the way. And myturn.ca.gov has it. If you have concerns your kid's going to be scared, maybe that's not the best environment, or maybe that works because, hey, if it's Safeway or there's ice cream, right down the aisle right after. The last thing I'll tell you is that this shot in particular, compared to tetanus and some others, is really not painful, and you can maybe have other kids talk to your kid. Maybe that'll trigger them, but it's a particularly painless one. My child didn't even know it happened by the time she kind of talked herself into doing it, and then she didn't know it was even done. It is very, very quick. It's a particularly small needle and a very small injection. And it's the injection liquid amount that often hurts because you're creating a little pocket in the muscle of the liquid. And so this is a very small amount. So I'm just letting you know from a kind of from an immunization standpoint, this feels less than the others, if that helps at all.
All right. Well, we're about out of time. But before we go, we want to remind everybody to join us next Wednesday at 5:30 p.m. That's November 17th, when one of our orthopedic specialists, Dr. Peterson, will be talking about avoiding injuries on the sports field. He's giving a talk called Play It Safe and Stay on the Field, with all kinds of advice and tips on how to stay safe when you're being athletic and active.
That sounds great. Thank you, everyone. Again, have a wonderful Veterans Day tomorrow, and I'll speak to you soon. Thanks.
Thank you, Dr. Kaufman.